that the future of medicine is to not see those as competing interests. I think everything is, you can provide access and excellence, and you can actually make one kind of play into the other and support the other.
How so?
A lot of science, when you look at what's studied, super interesting. Like you look at a study that dictates, a new medication comes out, right? They ran a clinical trial, and historically they would run that clinical trial, and they would run it usually only through what's called an excellence hospital, right? A high-end hospital that caters generally to affluent white men, right? And they ran a clinical trial that showed that a drug worked for affluent white men, right? And they didn't run a clinical trial that was gender equal, that was diverse, that showed, and we know that genetically some of these medications work better in some than others. You need to have access points for all type of people, old, young, every different kind of look, nationality, gender, everything. To say that your care works, it needs to transcend the differences in people. It's just a fundamental principle of care. And so one of the things I love about what we do is, I took care of, about 2 years ago on the same day, into my clinic, a kid whose father was one of the royals in the Middle East, flew their kid out with a cancer on a private plane, came out and saw me. And then in the next room, I took care of a kid who's the exact same age, who's a kid from South Central LA with no resources, same diagnosis, same thing. They get the same chemo, the same surgery, right? And if you can do that, if you can really provide that type of thing, then you start to see if what you're doing really is, if what you're doing is really right.
The champ is here. Tommy just walked in. Are you coming on, Tom?
No.
What do you mean, no? Don't be a why?
I fucking invited him for the third time.
Dude, Tom, you said that you were gonna be with your wife, bro. You said when I talked to you 2 days ago.
Come say hi.
Shut up. You say hi to Nick, dude.
Good to see you.
What's up, buddy?
Hi, guys.
Tom, come sit in here. Why? Well, you didn't get your nails done or some shit? Huh? Right now?
I said that. Good to see you. What are y'all talking about?
Well, right now we're talking about healthcare, and we're talking about we're talking about.
Basically, things Nick understands and you don't.
No, dude, I'm doing. Shut up, man. That was my disappointment with the last time I had Nick. I made fun of him too much. I didn't actually but it's no. I know you're making fun of me. I know. Tom, you really don't want to come in on this.
I gotta go figure out.
When are you leaving?
I'm leaving here in 2 minutes. I came in to say hi, give you a hug, say what up, see these guys.
Tom, if you have anything, just hang out, Tom. I think the thing that you said before about people like losing faith in institutions, it's very clear that like right now, probably more than, whether it's politics, whether it's people, believing in our country.